before I do that too, you have 5 hip adductors, right? 5 hip adductors. Mr. Richards, what are those 5 hip adductors? Okay. I can't read lips.
Sorry. I was so proud of myself then. I knew it all.
I know, and I was such a jerk. I was going to tell you earlier, but you seem so confident. You're like, dude. And I was like, I'm just going to let him run through it.
Okay, so Adductor I got to Magnus, I got to Brevis, Pectinius, and Gracialis. I can't never say that word.
Gracilis. It could be Gracialis. Gracilis.
Oat-like.
Which one of those? So that's true. They all live on the medial compartment of your femur, right?
Yes.
Which one of those is the longest of all the adductors?
Gracilis.
Yes, he's right, everybody. I know it's tempting to say adductor longus. That is the longest one of the ones named adductor. But the longest adductor muscle of those 5 is the gracilis, and that's very important because that means it crosses over the knee joint and inserts into, what's that thing it's called, Mr. Richards?
Goosefoot.
Yes, goosefoot, pes anserinus. It's on the medial proximal shaft of the tibia, so below the knee on the inside of the knee. And that's important because it helps provide stability to your knee. What do you suppose is the shortest hip adductor?
Pectinius?
Yes, Pectinius. He's absolutely right. So the adductor brevis is not the shortest. That's the shortest of the 3 named adductor. But Pectinius is the shortest. Which one? All 5 of these are between your thighs, but 4 are kind of in front of the front. I never know how to say this. In the middle of your thigh. Which one is in back? Most posterior.
Posterior is, I was doing this yesterday, the posterior one of them is the Magnus.
Yes, thank you. It is so posterior, everybody, that sometimes it acts as a hamstring. So I'm sorry to put you on the spot, sir, although I really enjoyed it. But what I was doing right there with Mr. Richards is that's the stuff I remember about the adductors. Literally everything we just talked about. That there's 5 of them. The gracilis is the longest. The gracilis inserts across the knee in the pes anserinus on the medial proximal shaft. That the pectinius, this is probably not as important, pectinius is smallest. That the adductor magnus is in back, in the middle of your leg, but in back, and the other 4 are stacked up in front of it. So if you're rubbing the back of somebody's leg, you're probably rubbing their hamstrings and their adductor magnus. If you're rubbing the front of their leg, you're probably rubbing their quads and their other 4 adductors a little bit. Right? If your hands are going around their leg at all. Cool. Thank you, sir. That was very helpful. Good job, too, by the way. Yeah, I mean, some would say perfect. You got every one of those right. That's beautiful. Okay. Let's do this. So let's just look at them really fast. I want to show you where these attach. Some of my favorite ways to work the adductors, by the way, are with a forearm on the inner thigh, because just like our hip work, I find forearms to be less invasive. There's your adductor magnus back there. I realize you kind of hit the gracilis here too, but it really makes up a lot of this back side of the leg. On the middle side, middle back. All right. You can see the other adductors here. See how they all stack up in front, the adductor magnus. This gives you a really good look here. This is a, let me get my cursor going here. There we go. This is a front view. So here's your pectinius, your brevis, your longus, and your gracilis going all the way down here. Look where the gracilis goes. It actually kind of wraps around behind the knee and grabs right here. The magnus is behind all these. The magnus is behind all these. So I know you can see it peeking out right here, but it is behind all of these basically. The magnus is behind them. I know I keep saying behind. Okay. Some things to think about here is how your hips are made, right? And Does anybody know what bone this is right here? This portion right here. Miss Hendrickson, please tell us.
The pubis?
This is the pubis. And this upper arm is called the superior ramus of the pubis. And this lower arm is called the inferior ramus of the pubis. And this inferior ramus, I'll show you it over here, actually goes back to meet a bone called the, what bone is this here?
Ischium?
Ischium. So the ischium meets your pubis to make the foramen magnum, by the way. I mean the obturator magnum, sorry. Anyway, so the pectineus and the adductor longus essentially grab onto the upper arm of the pubis here, superior ramus of the pubis. Your adductor longus actually reaches almost right to the dead center of the whole thing. Let's move it right along. Let's talk about the magnus here. So what they are showing you here is a front view of the magnus, right? Which you would never see it this way because there's 4 muscles in front of it. The back view, you don't even really see this way too because what's running over the top of this thing is hamstrings over here. Your hamstrings are here too, right? And your hamstrings grab onto this same ischial tuberosity. This big bone back here that looks like a coffee cup handle, it's actually bigger than that, but it looks like a coffee cup handle, is exactly that. It is a handle for massive, massive leg muscles to grab onto. I mean, look at this magnus, it's huge, and we've got 3 hamstrings that grab on here as well. So that thing is a handle made on purpose for massive muscles to hook to. Yeah. And obviously it helps to adduct your, what am I trying to say? Your acetabular femoral joint. You'll also see that they do mention that, and you don't have to memorize this, it's just kind of important to kind of conceptually get, it's so far back here, the adductor magnus, that it can also extend the hip, especially when the hip is forward in a flexed position. It can actually act a little bit like a hamstring. It's grabbing onto this thing, it's attached to the leg, it can act a little bit like a hamstring in the sense that it can extend the hip. It can't flex the knee because it doesn't go across the knee, right? And there is a hole in here, in the adductor magnus. There's a hole here. Have you ever heard the expression where somebody says, I'm going on hiatus? They'll sometimes say that when they're going on hiatus, it means they're going on vacation, usually. This is the adductor hiatus. So it's like a foramen, it's a hole. And it's here because you have to be able to get veins and arteries and nerves from one side of the leg to the other. And so you actually have a hole here for stuff to run through in the muscle. So it's not just an empty hole for no reason. Other nerves and veins and things run through it. Got it? But I don't want you to memorize all the fancy stuff where it says the origin is the inferior ramus of the pubis, the ramus, the ischium, the ischial tuberosity. They're describing this. By the way, this is the inferior ramus of the pubis, the ischial tuberosity, and the ischium. But I just want you to realize it grabs onto this entire back handle where the hamstrings do, right? And then really attaches itself to the medial lip of the linea aspera, which is also where your vastus medialis attaches. So you've got a lot going on around your hips. A lot going on around your hips. And this muscle is in back. So when we go to the next slide, we're going to look at muscles that stack up in front of here. Stack up in front of here. Why can we not see the muscles that stack up in front of here? Kind of wanted to look at them though. Oh, I guess that's how they want you to look at them. Here are the other 4 muscles that stack up in front. The ones we tend to care about the most are the gracilis, because if the gracilis has problems, it tends to cause hip problems and knee problems, if that makes sense. And the gracilis actually wraps around behind the knee and kind of inserts down in here. Right there. That's where your pes anserinus is. Okay. Miss Osuna, please talk to me.
I just have a question on how you, when you did the adductor group, did you wing out the leg or did you leave it straight?
Yes and yes. It depends. So if I am really trying to work it, I wing out the leg.
Okay.
I wing out the leg. I do secondary contact and actually cross their leg. I sit on the table. And actually put their leg on top of my leg and sit up there and work it. So their leg is winged out here and I work on their inner thigh. And I use my forearm because I can go up pretty high with my forearm without it feeling invasive. If I'm in a hurry and it's a 50-minute massage and I'm just doing a standard massage, I'm doing that all with hands and I don't wing out the leg. Right?
Gotcha. Thanks.
Thank you. It's a really good question. It's actually probably the most important question. Mr. Overman, yes, sir.
So I was just wondering, I know that goes like all the way up in your groin.
Yeah.
And I've had people like frog me out.
Yeah.
And like put the arm, not necessarily the elbow in there, but the arm up in there.
Yeah.
And holy crap, is that really uncomfortable.
Yeah.
Like, for me, I'm just wondering, like, is that everybody or is that me? Because it doesn't hurt, it's just very, feels funny, it feels weird.
Yeah, well, there's lots of things going on there. All right, so by the way, you've learned that nothing in massage is everybody or nobody, right? There's always an exception to the rule. Are you unusual? No. It's a vulnerable area. So just some things to think about as a massage therapist when you're applying pressure. Because when I say ask if they want more or less pressure, I don't want you to ask it every part of the body. You've got to make, once you think you've got the pressure roughly right and you figured out who your client is, you got to stop asking. But then you obviously adjust. I obviously use different pressure on your back than I do on your glutes, than I do on your face, right? So here's some rules of thumb that are true for almost everybody, but still not everybody, but almost everybody. The outsides of your body tend to have thicker skin and they tend to be less sensitive. So the outside of my arm is less sensitive than the inside of my arm. Even feel the skin there. Like the skin's all soft and baby-like out here. Out here it's all hard and whatever. And that's true of legs. Outer legs are used to bumping into things and they're used to being rubbed up against. Inner thighs are sensitive. So they require less pressure, period. So insides of things tend to require less pressure and we should all be cognizant of that. So if I know you can take a certain amount on one part of your leg, I'd probably do less on your inner thigh. That's one thing. It's an emotionally vulnerable place. I mean, the minute somebody frogs you out, you're like, whoa, thanks. Even if you're well draped and covered, you still feel like you're very exposed. It's a very weird position to be in, and I think that makes you a little bit more sensitive too. But you're absolutely right, Mr. Overman. It's a place that people need to be very judicious. So when I use my forearm, I'm not using it for power. I'm using it actually to be nice. I want to have big paint roller. You know, like when you're paint rolling a wall, I want to have those big paint roller sweeps. And if anything gets near your privates, I want it to be my forearm. That just is a lot better. And I don't like pokey feeling in my inner thigh. So actually going deep with fingers on the inner thigh to me is very painful. And I don't know that I've ever used an elbow on somebody's inner thigh. I mean, I have elbowed IT bands on hockey players and football players. I've elbowed glutes. I've elbowed everything, but I don't know that I've ever elbowed inner thigh muscles on somebody. I've forearmed them, right? But I've never had a need to go that deep on somebody's inner thigh, even when they're really developed, even on bodybuilders and stuff. So yeah.
I think it was forearm, not exactly elbow.
No, you said that. I just want to be really clear about kind of, yeah. So anyway, I do think it's an area you've got to be slow. You've got to think about what you're doing. And I think sometimes people also forget and they go too fast. And nobody likes a fast-moving thing coming up to their groin.
Yeah.
Like it's a nice sweep. Not like, you know. Yeah.
Is it also kind of like the armpit and the other joints where you got a lot of nerves going through there at the same time?
Yeah, it is a endangerment site, right where the leg hooks to the body. But we're not usually up that high, right? We're usually stopping an inch of that or something, someplace where we and the client feel comfortable. And so I don't talk about it a lot because it's an endangerment site that people really never get to. Whereas I guess the axillary region, somebody might kind of dig straight in there or something like that. Endangerment sites, everybody, don't worry about them as long as you feel like you're still on muscle and tendon. It's the soft area, the knee pit, the armpit, the groin pit that you got to worry about. But when you can tell you're still on muscle and tendon, you're fine. Yeah. But everybody is more sensitive there. Really good questions. Okay. So everybody, You do not need to memorize the origins and insertions of all the adductor muscles. Just know that they align themselves around the superior ramus of the pubis, the inferior ramus of the pubis, and the ischium back here, and the ischial tuberosity. That's where all of them go, by the way, because the adductor magnus would be back here too. And they all insert. Your book actually had a beautiful picture here. Come on. If it'll let me go back, it would. Sorry. They all just insert further and further down. That's why I asked Mr. Richards about which one was long and which one wasn't. The Pectineus is the shortest, so it inserts up high. Adductor brevis, next. Adductor longus, next. Adductor magnus was inserting along this entire area. And then the gracilis is the longest one, and it goes all the way across the knee. Now, this spot where the gracilis goes across the knee inserts, they're not showing the pes anserinus here. They're showing you one toe of the goose foot here. But when you have the sartorius coming down here and meeting in this goose foot, and you have the semitendinosus coming down and inserting the goose's foot, they help protect the medial side of the knee. Knees do not like to be rocked side to side. They do very well at extension and flexion. They do not do well. That's why every time you watch a football game, there's some football player running down the track and he cuts left and his knee stays right. And they carry him off the field, right? I don't mean every football game, but you know what I mean. Because knees don't do well with that. And so on one side, you've got the IT band supporting the lateral side of the knee. And on this side, you've got the pes anserinus with those three muscles triangulating to support the medial side of the knee. Lateral blowouts are more common, by the way, than medial blowouts. But anyway, Mr. Overman, please.
So I keep hearing this muscle sartorius. Have we learned that one?
No. So
okay, good. 'Cause I keep I've heard it over the last few.
We're
classes.
actually going to learn it tomorrow.
Oh, that muscle.
We're going to learn it tomorrow, and we're going to learn the tensor fasciae lata and the IT band. So all this will tie together really soon.
Okay, cool.
The sartorius is not in a muscle group, by the way. It stands on its own.
That's why.
And
okay,
it is.
I even scanned through the muscle group real quick.
You can't find
I
it.
missed it.
It's super. And I think it's actually sartorius, not sartorius. But anyway, it is a diagonal muscle that runs from your anterior superior iliac spine diagonally across your leg. And what's interesting about the sartorius, just so you know, is it runs across your quads diagonally. And it's a long strap muscle. And so a lot of massage therapists that don't know their anatomy rub up a thigh, and they rub across this muscle that's running across the vastus, the rectus femoris and the vastus lateralis medialis. They run up here and they pop over that muscle, and they feel this little pop, and they assume it's a knot. And so they start working that area, and what they don't realize, they've just run across this strap that's the sartorius.
Well, why isn't that a quad? If it's up with them.
Yeah, it's a because it doesn't insert in the tibial tuberosity via the patella and the patellar tendon. And it doesn't extend the knee. It actually flexes the knee.
Okay.
It's a very weird muscle, by the way. It actually creates three actions at once. I call it the hacky sack muscle. So if you ever watch something, I don't know, hold on, I gotta make sure I can see myself here. If you ever seen somebody play hacky sack where they bring their foot up in the middle and pop the thing up, that's my sartorius doing that. It actually allows me to laterally rotate my leg while flexing my hip and flexing my knee. It also lets you sit cross-legged. It's a strange little muscle. And it's very hard to see on people. What I recommend you guys do is Google bodybuilders sartorius. And you'll see some bodybuilders are lean enough that you can see the sartorius running diagonally across the thigh. It's worth a Google. It's pretty cool.
We don't need to do that. We have Jones. Jones, let's see it.
That's true. We probably do. If it was abs, I would ask him. Actually, let me see. Hold on. Body builder. Yeah. Hold on. Okay. I've got one for you here. Let me stop sharing this, just because it's worth seeing. Here we go. There we go. So, if you can see this guy here, now he's got his leg turned out, but this muscle right here is his sartorius. Do you see this, I hope? Boom. It's a hard muscle to see. She's got a great sartorius too. Boom. So it runs diagonally across your thigh and hooks back in down here, by the way. Anyway, kind of cool. Miss Savarino, please.
Just a quick question. Do you say knees don't like to go laterally or whatever? I
Yeah.
have crepitus in my knees, and I crack my knees by, like, going laterally, and it feels so good to me. So should I stop doing that? Because, I don't know. You're telling me they don't like to go that way, so...
Yeah,
Like,
I'm so glad you asked me to clarify. If anything in your body that you crack feels good, keep cracking it. All the evidence out there suggests you are absolutely fine. That if it feels painful, that's different. But that kind of crepitus and stuff that you're experiencing is absolutely fine. When I say they don't like to go laterally, I mean underweight. I just meant they're not designed to do that. Can you wiggle them around? Yeah. I mean, can you pop them, all sorts of? I meant when I'm running down the field, they don't like cutting movements, right?
Okay.
They don't do so well at that. Yeah.
Thank you.
Yeah, you keep cracking.
I will. I'm a crack addict.
Miss Young, you did have your hand raised for a second.
That was Jones, not me.
Oh, did I do that again? Mr. Jones.
That's all right. I'm good.
Okay. All right. Okay. Let's see. I got one last picture to show you guys, and then we will take a break, and then we'll talk about other stuff. Because this is kind of important, too. What I wanted to show you here is this, because it's a beautiful example of what Mr. Overman is asking about. Here's the sartorius here, coming across the knee. This is a bent knee, inserting into the pes anserinus. Here's the gracilis going across the knee, inserting into the pes anserinus. And here's the semitendinosus going across the knee, inserting into the pes anserinus. I just wanted you to know where the pes anserinus was. Yeah. And that is it. That's it. Okay. Questions before we take our break? Thank you for clapping. I greatly appreciate that. I don't deserve it, but I greatly appreciate it. Mr. Overman, yes, sir, please.
So, for memorization purposes, would you say it's correct from an anterior view that they range from shortest to longest, working their way distally?
I think what you just said is brilliant. Let's see. Would I say from an anterior view that they work from shortest to longest and they keep attaching more distally?
Yeah.
So it goes, essentially it goes pectineus, brevis, longus. Magnus was the whole way, but Magnus goes down further, and then gracilis. Yes, that's exactly what I look. And that's why I didn't get too nitpicky. When I went to school, we actually memorized, like, pectineus is on the upper arm of the thing. But it doesn't matter. They're hooked onto that huge coffee handle there, whether you're in front or behind. They're all hooked on that. And you're right, they go further and further down the shaft. Most of them are hooked to something called the medial lip of linea aspera, which is actually in back of your leg. But anyway, and you're right, they go pectineus, brevis, longus, magnus, and then gracilis. Yes, and that's exactly what you should do. And the only other thing I would remember with that, sir, is magnus is behind those other four. So if you kind of punched the front of my, I don't know why you have to punch, but anyway, if you punch the front of my middle thigh, you'd hit 4 adductors. If you punch the back of my middle thigh, you'd hit the magnus. Yeah. Well said. All right, everybody. 9:46.